Hey there, folks. Today I would like to talk to you about wastewater in the context of COVID-19. Now, if that sentence made you go, huh? Stick around for a second, and if you're excited by those words, boy, have you come to the right place. So, to get some caveats and disclaimers out of the way, I'm not a doctor, I'm not a public health person, I'm not an epidemiologist. We are going to be using peer-reviewed science and resources from the CDC in this video, so this is not going to be speculation corner. I'm just going to show you stuff and editorialize a little bit as we go, because I can't help myself. The other thing that I want to mention at the outset is that a lot of the discussion around wastewater talks about it being a way of predicting, how many people are sick with COVID. And it is certainly an indicator of that, but it's not a perfect replacement for knowing the total number of cases. That was data that we used to have access to. It's not being collected in the United States anymore, which is quite frustrating, but you got to deal with what you have. I'll add a little bit more nuance as we go, but for now, let's start by looking at a paper. So I kind of selected this paper at random, but this is a paper from back in the very early days of the pandemic, July of 2020, talking about how SARS-CoV-2 virus is shed in feces and urine. And they then went on to talk about how that could be contributing to transmission. The TLDR on that part of the paper is basically that really the risk of being infected from urine and feces is particularly high in like a home care setting where you're directly interacting with these fluids. But that being said, it's not really relevant to what we're interested in. What we're interested in is the fact that SARS-CoV-2 RNA is occasionally detected in urine and fecal samples. There's less of it than you would see in mucus, but there is a lot of it. These are perfectly measurable numbers. And of course, if you have enough substance, i.e. the sort of concentrations or the sorts of volumes that you see at a wastewater treatment plant, this is a great way to see what's going on. And indeed, this approach of measuring wastewater to surveil for viruses is not new. This is something that we've done for a while. So to start with our first resource, which is the CDC, they have a wastewater surveillance tab in their COVID data tracker, which we'll talk about in a little bit. You'll see that testing has actually been turned back on for commercial wastewater sites, which is good because it was off for a while, and this gives us more data, about 350 more sites. Anyway, if we look at what the CDC has to say about this, wastewater data, again, tracks the presence of SARS-CoV-2, the virus that causes COVID-19, in wastewater samples, and these data can provide an early warning of COVID-19 spread in communities. So one important thing to mention, if we take a look just at the tracker at a high level, if you just go to the CDC data tracker, you're shown this dashboard as like the first landing page, and you can kind of see that they've broken up the data into two columns. There's the early indicators, which include test positivity and emergency department visits, and then you've got severity indicators, which are hospitalizations and deaths. Because if you'll know this if you know, it's quite difficult to get admitted to a hospital in the United States. So you have to be quite sick to be admitted. And we can see that, at least for now, hospital admissions are up. Deaths are also up. Test positivity is starting to slow down a little bit, which could be a good sign. Again, we'll talk about that in a bit. And ED visits have been steadily increasing. So where wastewater kind of fits into this picture here is that, again, early indicator, this is when you go and interact with a medical professional because you're not feeling well. And then severity, kind of is the tail of the tape. Did you end up getting admitted? Did you survive the infection? And wastewater kind of acts over here in this area. It's kind of the pre-early indicator. One of the reasons for that is because you can actually shed virus even if you're not symptomatic. And that is actually something that they talk about. Let's see if I can find it. Yeah, here we go. So they mention here that wastewater surveillance can provide early warning. People infected with SARS-CoV-2 can shed the virus in their feces even if they don't have symptoms. So this is really crucial, actually, because it suggests that some of the COVID cases that we wouldn't have caught because the person, wasn't sick enough or wasn't sick at all, was asymptomatic and didn't go to the hospital, wastewater will see those cases, will see that COVID. But again, it's not an absolute number. You can't divide the concentration by some constant to get the number of people infected. It's directional in its utility. But in any event, SARS-CoV-2 can be detected. It can be shed by people who are asymptomatic. So in the early days, the CDC's visualizations for wastewater were blindingly complex and just really difficult to interpret at a glance. They did have this map here, which shows the level, the current virus level category, which is just some kind of arbitrary sort of delineation that the CDC came up with. But in any event, this kind of at a glance roughly tells you what's going on. We can see there's quite a lot of COVID in the Midwest. Wastewater, there's a lot of SARS-CoV-2 in the wastewater, a little bit less in the east if you just take kind of an average look. But fortunately, they have updated their visualizations, and we have some much nicer graphics that we can look at. So I'll have links to all this stuff because it's quite difficult getting from these different visualizations to each other. We're going to talk about that in a second. This is the COVID data tracker. This is the NWSS COVID national trend page. It's very confusing. Sometimes there are little textual glitches like this. Usually a refresh will fit these. Fix these. So right now on the landing page, we see that according to the CDC, the wastewater viral activity level is high. And this graph down here does a nice job of sort of showing us what's going on. Now, again, the y-axis is kind of meaningless, but that's not necessarily a bad thing, simply because again, it's hard to take the actual number, the fact that this says national is 4.04. What that actually means is, less important than the trend, which we can see at the tail end of the graph, that the amount of COVID virus that's being detected in wastewater is increasing dramatically across the entire country. And indeed, as a little bonus, if we think back to what we were seeing here, and a lot of cases, a lot of SARS-CoV-2 in the Midwest, we can see that this graph agrees with that. So this data seems to align with this data. And one thing I should probably mention is that no one indicator really gives you a holistic picture of what's going on with COVID. So you have to kind of stitch pieces together. But if you see that the wastewater concentrations are higher and hospitalizations are going up, or maybe test positivity is going up or admissions are going up in your area, these things in connection with one another can kind of confirm what's going on and help you decide whether or not you're going to, risk going grocery shopping or just have your groceries delivered. So going back to the data, if we keep scrolling, there are a few other charts that you can look at here. This is basically the same chart, but broken out by state. So if we wanted to look at California, we could do that. California is the selected state, so that's this curve. Do also note that we're looking at 1 year. We could look at all results. This goes back basically to the Omicron peak back at the beginning of 2022. And we can see that we're down here. Now, one other thing that I should mention, which is highlighted here, data from the most recent 2 weeks may be incomplete due to delays in data reporting. These data sets are subject to change and are indicated by the gray shading. So when you're looking at these data, you do just want to bear in mind that there is going to be an uncertainty around this data at the end of the visualization. And this is universal for pretty much any source of data of this type. It just takes time to get the data from the sites and average them and publish it and get it vetted and all that stuff. You can actually download the data for yourself, which is really nice and is something that I've done. If people are interested in what I've done with it, I could do a video on that. Just let me know in the comments. But I think we're going to leave the CDC now and switch over to talking about Biobot analytics. Biobot is one of the commercial partners that works with the CDC to analyze sewage. They say here with molecular technologies. I think that's called chemistry, and AI. Again, they're probably just doing some simple... Anyway, I shouldn't poke fun. So if we go to our data and we click COVID-19, this website's also so much easier to navigate than the CDC website. We see similar visualizations as my graphics card tells me it's time to update. So here we're looking at COVID-19 wastewater. This graph will, you'll note, look remarkably similar to the picture that we were seeing over here. So if we just isolate national, we can see that these two curves are quite similar. They're shaped slightly differently because we have actual units on the y-axis here. This is copies of SARS-CoV-2 per milliliter of sewage. So these numbers are actually meaningful. And we also know that they're not normalized, which is, this peak might look less tall because we don't know what's under these numbers, but again, not the end of the world. So what are the benefits of Biobot? There's a couple. The first is that you can compare year over year, and this can help you get a feel for how what we're currently dealing with correlates with past COVID experiences that you may or may not have. Now, again, it is important to reiterate that a year ago, so for example, if we look at the 2022 curve, which is in green over here, the variants that were around in 2022 are significantly different from the variants that we have now. And in fact, we're going to prove that in a little bit when we talk about variants. But I'm saving that for last because it's more nerdy than useful, but I want to talk about it anyway. So anyway, you have to take a little bit of a grain of salt comparing year over year, not to mention the Omicron wave in 2021 kind of blows this chart out a little bit. But you can see we're here in this kind of pale lime green in the middle. So, it's hard to say what this actually means. The other thing that's also important to mention is that, again, there were times this year where there were less sites reporting. So not necessarily the most useful thing in the entire world, but the thing that's really nice is that they've got cases overlaid here. So what this allows you to do is see how cases and wastewater might correlate with each other. We see that early on in the pandemic, very, very tight, robust correlation between the wastewater and the number of cases. Now, again, you have to bear in mind that the y-axis for each of these data sets is different. We've got, this is 1 million cases right here, and so you have to sort of keep that in mind. But this suggests that down here, when we stopped keeping track of cases, which we know happened because we were told it as much, and certainly down here where there are no cases anymore, it gives you a rough idea of how many cases there might be. Now, again, I know I've said this 3 or 4 times now, but just to really hit this home, this is 640. So if I go over here to also 640, this does not mean that the current amount of COVID is similar to May of 2022, right? Because there's a lot of variables that play into this blue line. But in any event, the visualizations are much easier to read, I personally think. We've also got a similar regional breakout, and then they have some variant information here, which is really nice. And again, we'll talk more about that in a bit. So to kind of wrap this up, and then we'll nerd out and talk about variants for a little bit. Wastewater is a very robust way of getting a rough idea of how much COVID is sort of about. It is a very early leading indicator, so it might allow you to kind of predict what's going to happen. You can drill down to the concentration in wastewater in your state, or sometimes even county, depending on what your state's government is publishing. I think that some of that stuff can be very difficult to judge because you're dealing with relatively small numbers of data, and so it can be a little bit challenging to judge the right thing. But overall, it's essentially one of the few numbers that we know has to be true because we're just looking at sewage and we're just seeing what's inside of it. So, with that said, I'm just going to do a quick little ramble about variants because it's really fascinating. Biobot, this is one situation where the CDC actually has a nicer data set and visualization. Let me see if I can find it. Here we go. So if you go to the variant summary in the COVID data tracker, they have this nice nowcast. So data for the 2-week period ending on the 9th, which was the end of last week. We can see that they're predicting that JN.1, which, in case you're unfamiliar, is a new variant that broke off of the 2.86 variant. They're saying here that it's an Omicron, which sure, I mean, I'm not going to get into that. But this is very interesting if you're curious to see if there is a dominant strain, because we do know that some of the strains have particular reactions to vaccines, right? And also we know that they have different symptoms potentially. And so that can be helpful if you're trying to decide if you need to, get a test or something like that. So anyway, that's going to be it for this video. I apologize for this being fairly unstructured and rambly. Again, this is kind of my first shot at this. If you have questions or comments, please put them down below and I'll do my best to answer them or direct you towards people who are equipped to answer them. Apologies for the camera. That's going to be the first thing that we're going to upgrade here. And yeah, thank you again for watching, and stay safe. Wear a mask.